Capital City Sunday.
Good morning this week on Capital City Sunday.
There's still ripple effects being felt across the Chippewa Valley.
As Chippewa Valley residents are working to adjust to the devastating losses from recent hospital closures, Republican Senator Jesse James joins me on the show for an update on why the state's budget committee has not released funds allocated to address the issue.
If suddenly that workforce disappears overnight, we will feel that in the prices of everyday goods.
And as President-elect Donald Trump says he plans to seal the southern border with sweeping immigration reforms, I sit down with immigration law professor Rafi Friedman to unpack what communities would be most impacted. Thank you for joining us. I'm Darrielle Fair. It has now been more than 8 months since the HSHS St. Joseph's and Sacred Heart hospitals closed their doors, leaving communities in the Chippewa Valley without access to emergency health care resources. A bill allocating more than $15 million to restore emergency management resources in the region passed earlier this year, but the Joint Finance Committee has yet to release those funds. Following those closures, the Chippewa Valley Health Cooperative formed in an effort to develop a solution to those vacancies, announcing last week that it is now planning to build a new hospital, which they say is set to be opened in 2027. They also say they plan to reopen St. Joseph's so patients can be taken care of as, quote, fast as possible. Democratic Representative Jody Emerson applauded the announcement, saying in a statement, the Chippewa Valley Health Cooperative's commitment to building a new hospital in Lake Hallie is a crucial advancement in restoring essential healthcare services to our community. Their dedication to providing comprehensive, locally governed care is commendable and vital for the well-being of our residents. Emerson calling on the Joint Finance Committee to take legislative action to release the $15 million to the legislature approved. Joining me this morning is Republican Senator Jesse James. Senator James, thank you so much for your time.
Thank you for having me.
Joseph's Hospital in Chippewa Falls and Sacred Heart Hospital in Eau Claire have been closed for nearly 8 months now. How are those communities feeling about the impacts of the loss in health care?
Yeah, the ripple effects of both St. Joseph's Hospital and Sacred Heart Hospital closing, there's still ripple effects being felt across the Chippewa Valley and beyond, for that matter. But the reality is our people in the Chippewa Valley, they are resilient. We are survivors, and we continue to pull through as a community as we identify the purpose and the partnerships and the continued collaborations. Mayo and Marshfield has stepped up immensely to absorb a lot of the overflow of emergency room department services, as well as the announcements from Aspirus and the Chippewa Valley Health Cooperative coming into Chippewa County is going to be extremely valuable as we navigate further down the road.
And as you just stated, Aspirus Health and the Chippewa Valley Health Cooperative have both announced plans to build new hospitals in the region, which is expected to take a few years. What is being done in the interim to help mitigate that vacancy in health care left by those closures?
Well, again, with the Marshfield and Mayo stepping up and taking on the extra patients, I've been in the ER at Mayo with a family member, and it is definitely being felt. I was able to experience the setup that they have with their kind of internal emergency department expansion, to where there's literally rooms with curtains. It's not a room, you're in the hallway and the curtain is closed, and you're sitting in the hallway there waiting hours until you're seen, and obviously they triage you and base it on priority. I think there also is an element of education, to where if we can do it as a patient, if you can use urgent care services versus going to the ER, I think that's extremely valuable. And just knowing the times and availability of when the urgent care centers are open.
Senator James, last week in a statement, Representative Jody Emerson first applauded those efforts before calling on the Joint Finance Committee to release the $15 million allocated to address the crisis. You brought that legislation forward back in February. What do you have to say to the Joint Finance Committee withholding those funds?
Well, so there's a process here, and first and foremost, the legislation that was drafted was two bills, and the governor used his veto pen to dramatically change the legislative scope of the legislation. And that's part of the issue. We're asking for the $15 million that was originally allocated for mental health services and improvement in the Chippewa Valley for mental health services to be done, and we use those dollars that were already allocated for the building fund for that, and use that was available for the emergency department expansions. And when the governor vetoed the legislation and expanded the amount of territory going to 18 counties to where this $15 million could go to, as well as the expansion of the services, when back at home we were hearing the immediate need would be the emergency room department services that needed to be taken care of, because the medical professionals, not only in the Chippewa Valley but across the state, were anticipating this immediate need for this. And Mayo and Marshville could have used those dollars for the expansion, as well as now Aspirus and Chippewa Valley Health Co-op with the emergency department addition and expansion of services, even with the potential of Chippewa Valley Health Co-op using the dollars or being able to get St. Joseph's into play for the immediate emergency need for department services. You know, with the pending litigation and all the pointing of fingers, this is the political hot potato that's played. I wish that we could have had a discussion with the governor prior to him deciding whether to veto or bill sign the legislation. Instead, I think he chose to veto it because I know he was made aware of the Chippewa Valley Health Cooperative plans as well, and $15 million would not have gone very far to be spread amongst 18 counties and for those services. So that's the reality that we're facing right now. I'm looking forward to the next session to see what is going to happen. I'm still trying to get a pulse of how this next session is going to go. But you know, the conversations are still going to be had, especially with the new development of Aspirus and the Chippewa Valley Health Co-op investing into Chippewa County.
And to your point, are there plans to address or revisit that legislation in the upcoming session? Have you had a chance to speak with your Republican colleagues on the Joint Finance Committee on whether they plan to bring the proposal forward?
There are discussions taking place.
Republican Senator Jesse James. Senator James, thank you so much again for your time.
Thank you for having me.